Hello to you all, my friends and my listeners. I am Dr. Rahul Agarwal. I am a senior consultant physician and diabetologist in MaxCure Hospitals, Madhapur, High Tech City. We were discussing about complication of diabetes and the organs that it can affect. So there will be no guesses, no prizes for anybody who can guess that what is the leading cause of chronic kidney disease and kidney failure in the world. It is diabetes. So what can cause diabetic kidney disease? How can we able to recognize it? What are the risk factors and how can we prevent and treat such a problem is today's topic. So diabetic kidney disease, as I said, is the leading cause of the kidney failure in the world, and it is preventable to some extent. Diabetic kidney disease, like the eye problem, depends on the duration of the diabetes, how long the diabetes has been there in somebody. If there are two people who is having say 5 years, the other is having 10 years of diabetes, if they have had similar control of diabetes, the person who have had diabetes for the last 10 years is a much higher risk of having a diabetic kidney disease than the person who has had it for 5 years only. So depending on the duration of diabetes, person should start being alert and aware that yes, there is something called as a kidney related problem in diabetes, and I should be very much aware of the problem and treat myself accordingly. What are the risk factors? Apart from having uncontrolled diabetes and duration of diabetes, there is another risk factors that are uncontrolled hypertension. There are atherosclerotic risk factors, meaning the hardness of the arteries that can happen in the brain or the kidneys and even in the heart. These are all the other risk factors. Then there is hyperlipidemia, meaning somebody's cholesterol levels is very high. They are also in a very high risk of having diabetic kidney disease. And if there is also the inherent problem with the kidneys, like somebody has a stone or somebody has got polycystic kidney disease, they are also in a higher risk. How to identify it? So the first and the foremost thing one should understand is that lot of times even before the first diagnosis of diabetes, there is established kidney problems. So lot of time and studies have proven it time and again that if I am able to get my diabetes checked today and get to know that I am diabetes today, unfortunately I will be having diabetes from a long time. The time being about 5 years. So you can understand the kidney problem should be there before that also. So as the first diagnosis of the diabetes, you should be start being aware, and the physicians and the diabetic care specialists and nephrologists should start telling their patients about diabetic problems in the first instance itself, because that will go a long distance in making the patient educate that yes, there is a problem like this, and even if there is nothing right now wrong with my reports, I am at a very high risk and there is some damage that is already present. So there are simple methods, there are simple laboratory studies that can tell the presence of a diabetic problem. The one of the most common is to do creatinine levels. The blood creatinine level is a surrogate marker, we say. It is not exactly fitting into the kidney problems, but it is the most what you call as nearest to the kidney damage that can be told. So if somebody's creatinine level is slowly getting up, then the person is having a kidney damage. And if the patient is also having diabetes, we take it for granted that the kidney damage is mostly because of diabetes related problem. Then we calculate something called as an estimated GFR, estimated glomerular filtration rate, depending on the kidney creatinine levels, depending on the age and the sex of the female of the person, and also the ethnicity. All these parameters we use into something, a formula called as EGFR formula, and depending on that we classify diabetes into stages, stage 1 to stage 5, stage 1 being mild and stage 5 being the worst of them all, that is called as end stage kidney disease. In cases of stage 1 or stage 2, probably in early stage 3 also, there is no active treatment required other than the patient's blood pressure and sugar levels has to be maintained. If the patient is able to pour out good urine, there is no extremity, any accumulation of fluids, then we can start him on first is strict dietary and lifestyle maintenance, diet control, diabetic control, and third and most important is a class of medications that is an antihypertensive drug that is called as ACE inhibitors. ACE inhibitors and angiotensin receptor 2 blockers are different types of antihypertensives which have known to also help in reversing or even at least delaying the process of the kidney damage. Then there is a new drug called as sacubitril valsartan that is also combination of an ACE inhibitors with an neprilysin inhibitor. This type of medication is also nowadays known to help in those people who have had kidney disease and in heart failures and also in diabetics also. Again, of the total medications available for diabetes, one of the class of drug is called as SGLT2 inhibitors. The class of the function of this particular drug is on the kidney levels, and because it functions at the kidney level, it has been found to be what is called as renoprotective, that is kidney protective. On the long run, it has been shown to have beneficial effects on the kidneys. So in the initial stages, we always rely on the medications and we always rely on the lifestyle changes and dietary and hypertensive and cholesterol control. As the disease progresses, which is very difficult to control, slowly the disease will progress and the patient becomes symptomatic. What types of symptoms there will be there? There will be a lot of fatigue, patient will stop eating properly, there will be a lot of accumulation of water, specifically so in the heart, lungs and in the extremities. The patient will tell that I have got a swelling of the feet and I am not able to move around properly, I'll have muscle cramps and all that. So these are the symptoms which should alarm somebody of having a bad kidney disease. Once the EGFR is telling that the patient has gone into end stage kidney disease, there is no other choice but to start initiating a dialysis program. The dialysis can be done in two ways, either in an acute setup, meaning emergency setup once there is an infection or something that the kidney has stopped working, or in a chronic setup, that is a maintenance hemodialysis, in which the person will be asked to attend the dialysis clinic like about 3 times a week, and depending on the nephrologist's discretion, he may also have something called as a peritoneal dialysis. Peritoneal dialysis is usually a little bit less cumbersome than a hemodialysis, in which a person who is actively say going around, he has got daily work around, and a working person can have a CPPD. And hemodialysis is also less costly, but it can be done thrice a week. So the kidney also functions, other than filtering the waste products, kidney also functions for our important metabolic organs like the calcium and magnesium metabolism. So calcium metabolism also becomes very bad, the vitamin D levels shall be going low, and the immune function of the body's immunity to infections also becomes very less. Similarly, there is a very important organ called as erythropoietin that goes down when the kidney is not functioning. Of all the nutrition available in the world, if there is no erythropoietin in the body will not have the drive to make much blood and the patient will become anemic. If the patient is having anemia, there will be not only further kidney damage, other organs of the body including the heart will be affected. So we have to recognize that the diabetic kidney disease is a very high risk for having anemia. So we have to correct it by giving it regular erythropoietin injections from outside. Similarly, those who are having diabetic kidney disease are very high risk of having hypertension also. So in those patients with diabetic kidney disease, strict control of hypertension becomes a very integral part of the disease process and treatment process. So in overall, once somebody has got a diabetes, the knowledge or education of the presence of a diabetic kidney should be immediately explained, and then the patient should be made to go to the ophthalmologist. Otherwise the patient usually doesn't go. Why should I go to the eye surgeon for no reason? So if you are able to tell him that this is the problem that you will be facing in the future, if you are not able to recognize and treat early the diabetic kidney disease, you should ask the patient to reach the nephrologist, and then yearly checkups of your kidney and eyes. Then only they will be able to save these two organs very importantly, which are irreversibly damaged. Thank you so much and stay healthy.
Subscribe our YouTube channel to watch more videos.